Hello, everyone. My name is William Seitz. I'm a senior economist at the World Bank. 56, dynamically identifying community-level COVID-19 impact risks for the Data for Policy Conference 2021. This is joint work with Eldar Tulyakov from the Development Strategy Center of Uzbekistan, Obid Hakimov from the Center of Economic Research and Reforms of Uzbekistan, Avra Murodjov, who was at Cornell University and World Bank consultant, and Saviya Muradova, who was at Ankara University and also a World Bank consultant. So this paper summarizes some work that we did early in the course of the pandemic. And we were trying to address a particular set of challenges or some problems that were very pressing at the time, in the early phases of the pandemic. So we knew that society was facing an unprecedented shock from the COVID-19 pandemic. We had a lot of concerns about sort of people losing jobs, people getting ill, people not being able to sort of make ends meet. So, but we also knew that the needs were not all the same and the resources were limited. And so the hope was to help policymakers to identify those people who were particularly in need, who had a very elevated needs during this particular phase of the crisis. This was a challenge in Uzbekistan in particular because a lot of the information that would be useful for making these types of decisions and allocations and identifying those people who were in most need, that information is just not available. So there's administrative data that's collected, at the local level of small communities in Uzbekistan. This is sort of done in lieu of a census, which hasn't been done for the past 30 years in the country. But that information wasn't sort of aggregated to the national level. It was only available sort of at the regional level, and so this information wasn't sort of in the hands of the people who needed it at the time that they needed it. There was also a challenge in that the official surveys, which were done in person, were disrupted due to the pandemic, and so most of the survey-based information about household well-being and incomes and remittances and so on, were unavailable due to the lockdown measures that prevented enumerators from going around people. And so then the question was, so how should the authorities be making some of these allocation decisions and how to focus the support of people who needed it, in the absence of information? So together with our partners, we tried to pull together the information that was available and use a few techniques to combine it in a way that would provide even more detailed information that could be done from each sort of source of information alone. So first, we collected and organized the local administrative data that are being collected by each neighborhood in Uzbekistan. So there's about 9,120 neighborhoods. They're called mahallas in Uzbekistan, and each of them has administrative data that was being collected, but it wasn't systematically available. And so we quickly sort of pulled together some of that information so that it was all harmonized in a similar format and available to those who needed it. We then matched that information with an ongoing survey that the World Bank administers called Listening to the Citizens of Uzbekistan. It's a monthly panel survey with about 1,500 households. Because it's done over the phone, so it's a monthly phone interview with the same households every month, the survey was not interrupted at all during the pandemic. And so it provided a real-time source of information about the impacts of well-being of the population. So we then use small area estimation techniques to complement some of the administrative data that's collected. So the administrative data is directly observed, but there are other indicators that are of interest that we can use small area estimation techniques to complement that. And then we use this combined information to create a summary index of risk factors. So risk factors for each of these 9,125 mahallas in the country that sort of give an indication of where there are elevated risk factors among the population. So, for instance, a large concentration of elderly people, a large concentration of people who are reliant on social assistance measures and so on. So we're going to get to that, some of the details in a few minutes, but that's kind of the intuition. And then at the end of this whole process, there's a full database which provides sort of the risk measures that we've estimated, all of the individual indicators that we've collected, combined in a single harmonized and clean data file that is available to policymakers to make their decisions. So just a little bit of information, just about how the pandemic affected Uzbekistan. So the Listening to Citizens of Uzbekistan survey highlighted sort of the severity of the crisis in the early phase. Employment fell very dramatically after the outbreak. So in April 2020, there was a 40 percentage point decline in the share of households reporting at least one actively working household member. Recovery began in May and it accelerated in June, but the impacts were severe and the labor market didn't recover its pre-crisis level, anytime in 2020. Remittances also fell by more than half in the initial phase. This recovered a little bit more quickly, but in the first month and 2 months, the amount of remittances coming to households that depended on them typically fell quite substantially and quite steeply. But the government acted very quickly to introduce mitigation measures. So emphasis on the labor market and social assistance measures to those who were. So these are just some graphs to drive home what I was just describing. So there was a big spike in the share of households reporting that at least one member had lost a job in April, recovering somewhat in May, and through June through November, but only reaching something similar to the previous year in November, December. The share of households that had at least one member working, also declined precipitously in April. Recovered quite substantially in May and June, but it did not recover its pre-pandemic level at any time in 2020. So to achieve the objective that we set out, we started with the administrative data, so collecting and merging it together. So the regional authorities, 14 of them in the country, had collected the Mahala level information at that level of administration, but not in a single standardized format or data processing protocol. And so we collected the information from all 14 of the regional authorities and then sort of harmonizing the information using the same sort of processing, treatment of missing values, the generated variables out of the raw data. And so all of that information yielded a full database for the entire country. And then we had another effort that had digitized some of these records for a particular number of mahalas in the country, and we cross-referenced the information that was digitized to validate the accuracy of the information that was collected and to ensure that the indicators that were being included in the database, we had a relatively high level of confidence in. The next step was to use the survey-based information to develop a model to predict certain values or to generate certain values using small area estimation that were not observed directly in the administrative data. So we only did this for particular, indicators that were of particular interest or particular importance. For instance, migration, remittance, reliance, incomes from work and employment status, and a few others. So this comes with some confidence interval around it. It's not a direct observation. It's a model-based estimate that's corrected. For those areas that are observed directly, there's a sampling error, and then there's modeling error. This has to be represented accurately in the reporting, but this provides a great deal more information than would be available just from the survey alone, because the survey is not representative at the level of Mahala, certainly not the level of Mahala or at the level of the Rayon, which is between sort of the regional level and the neighborhood level. But the small area estimation technique sort of leverages the complete information that we have from the administrative data and shrinks the confidence intervals so that the estimates at the local level are more accurate. So here we can see, for per capita consumption in 2011 PPP equivalent terms. And you can see that there's quite a bit of variation here. Parts of the country, around Pakistan, Sudaria, if you know the geography of Uzbekistan a little bit, you can see that, as expected, lower incomes there. The area around Tashkent and the city of Tashkent, the capital, is, average per capita consumption is quite a bit higher. Pockets of lower consumption levels in the Fergana Valley. Then we can also look at the share of households with any concentration or clustering migration patterns in the country. And then we used all of this information, both the information from the survey and the information from the administrative data, the derived estimates from the small area estimation, to create an index. This used the Alkar-Foster method at the Mahala level. So we had an index value for each of the Mahalas in the country. They could be grouped into sort of highest severity, lowest severity. And the weights for each of the indicators used in this indicator was the result of a survey that we did, not a representative one, a qualitative one, among various partners who were involved in the response effort for the COVID-19 pandemic. So this included government officials, it included academics, it included international organizations, UN agencies, and so on. And the summary of the responses in terms of what the biggest priorities were was used to select the indicators as well as the weights for each of the indicators. So here you can see which indicators were used. There were 6 dimensions. So elderly and health was one dimension, economic risk factors was another dimension, reliance on social assistance and other services, and density and other migration and poverty related indicators. And each indicator has its own weight. So you can see that some of those indicators have higher weights, reflecting this process that I was describing before, where we surveyed stakeholders to help us derive the weights for each of the indicators in the summary index. So here you can see the results aggregated to the rayon level, so one level above the Mahala. And you can see that there are some areas in red or orange and yellow which have elevated average risk factors, and areas of blue with lower average factors. But the index itself is at the Mahala level, so there's quite a lot of variation within each rayon, within each region, in terms of all of them have some areas that are at higher risk and others that are at lower risk. And so just again, in a short summary, you can see that the profile is quite different, for rural and urban areas, and there's some regions that had overall higher levels of risk factors on average. So Sudaria and Pakistan in particular had much higher, as well as Namangan in some cases. So the results also provide us with some information that we can use for disaggregated measurements over every month on these particular indicators of importance that I was describing before. So these are small area estimates that are coming from the survey, so the information is being updated every month. And we can disaggregate that information using small area estimation techniques to look at sort of the impacts at the local level. So here, this is the share of households reporting that no household member was working in the 7 days before their interview. You can see that there's a couple of concentrations of that, but relatively low levels overall. Once the pandemic hit, we can see the situation dramatically changed. So a much higher share of households reporting that nobody was working. That there were concentrations of this as well. There were some areas that had much higher risk factors of this than others. In particular, areas, urban areas and small, medium-sized towns and medium density areas were particularly hard hit, according to this measure. As the pandemic progressed, we can see that things began recovering. The situation began to recover, but not equally everywhere. So some areas were recovering more quickly than others, and in particular, agricultural and rural areas were recovering more quickly than urban areas were. And finally, you can see in June that there were still some clusters of areas that had stronger lockdowns, more people out of work, whereas much of the country had begun sort of going back to work by June 2020. We can do something similar with already received remittances. So this is before the pandemic began. You can see that the share of households reporting any remittances fell precipitously in April, but that started recovering. Interestingly, not in the same places, as sort of pre-pandemic. There were areas, especially in Pakistan and a few other clusters, where there were more remittances that were being sent than pre-COVID outbreak levels. But that started to normalize as well in June 2020, and we monitor this, of course, on an ongoing basis thereafter. We can also look at income. So this is a combination of income from, say, remittances, from labor, from social assistance, from pensions, from all sources. And you can see this again before the outbreak. During the outbreak, a large decline in total income per person, recovering somewhat in May and even further in June using the same method, disaggregated to the rayon level for the purposes of seeing sort of the spatial dimensions of the crisis. So, this information was being updated regularly. Of course, the administrative data less, but the survey data was being updated every month. And so this was being piped into a data dashboard that was shared with our government counterparts who were coordinating the response in Uzbekistan, and other agencies and those who were working on the response efforts. And so this data dashboard was available and could be used to sort of zero in on particular indicators of interest or particular risk factors that were relevant to a particular response effort. So for those, for instance, who are focusing on the elderly populations, you could look at just those indicators relevant to that. You could look at those who were receiving social assistance in a spatially disaggregated way, where labor market impacts were higher vis-a-vis the other sort of indicators. And so this dashboard, allowed flexibility from the policymakers' perspective to sort of highlight the particular issues that were relevant at different phases of the pandemic. So I think I'm going to stop here. I'm very grateful for this opportunity to share all of this with you, to the conference organizers, you for listening, for getting this far. I'd be very grateful also for any comments or feedback. My name, again, is William Seitz. My email address is wseitz@worldbank.org. Very happy to receive comments, feedback, or brainstorming discussion on some other applications of this type of work that could be interesting to discuss in the future. So thank you all again.